There's something wrong with Britain's vaccine rollout. The country's way ahead of the rest of Europe, but vaccine hesitancy could derail government plans to give every adult in the country a dose by September. The hesitancy is down racial lines. In a country where black women are 5 times more likely to die during pregnancy, and COVID death rates for most ethnic minorities are higher compared to white people. Long-standing health inequalities, say leading doctors, have eroded confidence in the vaccine. In a recent survey, 72% of black respondents said they were unlikely to have the jab, despite being most at risk of dying from the disease. And according to one study, 1/5 of all care home staff and many workers in the country's National Health Service, the NHS, are choosing not to be vaccinated.
1.4 million people work in the NHS. They are part of our society, and what happens in the wider social world is bound to be reflected within the NHS workforce. Now, what we do not want is for that fake news or that misinformation to take the lives of individuals due to a potential lack of understanding of the facts.
This is the hospital where the Prime Minister Boris Johnson was treated when he contracted coronavirus. The hospital trust told us that overall 80% of staff have been vaccinated, from surgeons to secretaries, but only 1/4 of black African and black Caribbean staff have, and even fewer staff from Filipino backgrounds.
A vaccine scandal that plagued the Philippines for years has had a negative impact on uptake here. Developed by a French company, Dengvaxio was proven to dramatically reduce severe dengue fever, but had to be relabeled after it was found it could cause more severe illness in children who hadn't already had the disease. Even though none of the 30,000 children in the clinical trial were affected, and the vaccine still worked well, the damage has been done, affecting the use of a whole range of proven treatments.
I look after international nurses, and the ones that are coming are the younger generation. The children that were given injection could be relatives of the nurses who we have now, or people that they already know, or, and that scares them.
A vaccine centre in a Birmingham mosque. The government says it can't force people to have the jab, but what it can do is tackle some of the myths surrounding the vaccine, including that it contains pork or can alter people's DNA, and that means reaching out to different communities, reshaping the narrative to help people make the right decision. Neave, Al Jazeera, London.